The number of hospitals offering healthcare services to infants and children at night or on weekends is declining dramatically here in the country amid a severe shortage of pediatricians. So why is there a medical personnel shortage? And what are the social repercussions of these shortfalls in essential healthcare? How are relevant authorities working to tackle the personnel shortage in the medical arena? Welcome to Issues and Insiders. At present, Korea has some 130,000 doctors amid a population of 51 million. And pundits say in the absence of prompt government intervention, up to 27,000 doctors will be needed by the year 2035 to meet basic healthcare demands. For more on the situation, I have Professor Kim Moon Kyu from Yonsei University here in the studio. Professor Kim, welcome back.
Thank you for having me.
I also have Dr. Alice Tan from MizMedi Women's Hospital with us. Dr. Tan, as always, it's a pleasure.
Likewise, thank you for having me.
Right, Dr. Dan, then, what is meant by essential healthcare fields first?
Right, so all medical fields are, of course, important for human health and development. Perhaps I can start with an example of what's not essential, just to give an example. So ophthalmology is a field of medicine that deals with the eyes. It's considered not an essential medical field, even though it's very important because, of course, a person can live who's blind, they can function perfectly well in society as long as they have their disabilities accounted for. Whereas other medical fields are dealing with potentially life-threatening conditions, and the doctors are treating conditions that are related to life and death all the time. And those would include internal medicine, pediatrics, general surgery, obstetrics and gynecology, and also the surgical fields of neurosurgery, thoracic surgery. Some people would include urology. I would actually include anesthesiology as an essential field because, of course, you can't have any major operations without anesthesia. And here in Korea, unfortunately, suicide is a leading cause of preventable death. And suicide, of course, is a medical emergency. And I think so psychiatric medicine should be included as an essential medical field. And so these are fields that are necessary for any society to maintain the health of its people.
Right. And Professor Kim, how do you explain this current shortage of doctors, generally speaking?
Current problems we face is an accumulation of long and somehow inadequate healthcare policies. If we leave these problems without doing anything, I think this will end in a huge health crisis in the near future. As Dr. Dan mentioned, many specialists are having very hard time to just maintain their capabilities, and improvement is something even hard to think about for right now. Korean health insurance system started in 1977 by Park Jung-hee, and as a result, I do believe that it did a huge contribution for our nation. There are some pros and cons, but anyway, it's positive. But Korean health insurance system inherited some fundamental contradictions which started from the beginning of its program. Because when we first started it, we imported many things from Japanese system. And the personal income was quite different from that point of time, and the exchange ratio is also different. But there are some problems in that application, and especially we have many weak points in the medical fees for critical care. Especially physicians who deal with patients in critical conditions are lacking in Korea right now, even before the pandemic. And I do believe that this pandemic exaggerated somehow. So I think Korean government had to understand the situation, working with the doctors to solve this problem.
Right, and before we talk about some of the potential solutions then, Dr. Dan, what look to be the broader social repercussions, if I may, of this medical shortage, especially within the essential fields then?
Right, so in a medical emergency, of course, time is of the essence. So any delay in receiving appropriate medical care in a medical emergency, such as trauma, heart attack or stroke can lead to death and disability. And so in these kinds of medical fields, the essential medical fields that we talked about, having enough physicians is of vital importance. It's really a matter of life and death. Beyond these emergency situations, though, say in a clinical setting, if you have too few physicians, basically the doctor to patient ratio is such that a doctor is not having enough time in the clinic to go over, say, preventative medicine or health promotion information, and that can, of course, lead to adverse health outcomes down the line. And finally, if we think about the amount of education and training that goes into developing the skills of, say, a cardiac surgeon or a neurosurgeon, right now we're facing the situation where we may have a 10-year or perhaps even a generational gap where we are not having enough neurosurgeons to take care of not only our patients, but also to train the next generation of doctors. And that could, of course, have a spiraling negative effect on our healthcare system. So there are a lot of ripple effects to what's happening right now.
Right, I see. And Professor Kim, also in recent times, there have been quite a bit of local media coverage about the shortage, of course, of pediatricians in particular. Speaking within your capacity as a pediatrician yourself at your hospital, is this reality also being felt by you personally?
I'm feeling it very harshly. This is not a shortage of the doctors, it's just a shortage of the pediatricians, and the reason very complex. Many people mention about the low birth weight. Yes, it's a big problem, but it's not just a problem for pediatricians, it's kind of a nationwide problem. It's critical for the survival of this country. But this problem is not an urgent one, it's kind of a more long-term issues. We have to look at the doctors who are in the situation to decide their specialty. I would say they are on internship, and usually they foresee about 5 to 10 years. They don't have a long-term insight to look at the future. And they see uncertain future for pediatrics, which is exaggerated somehow, and I think we can correct this problem. So let's look at the care about the children. It's very sophisticated because we need more time to care of the children, and it should be more careful, and we need more manpower, and even risky sometimes because we have to sedate and persuade them somehow. So everything is quite different and hard, but this is totally ignored, and the government applies the same system with the adults. The medical fee is almost the same. If you have to check the ECG for children, for adults it's easy. We just tell them to lay down and do not move and something like that. But sometimes we have to sedate the children to have a simple ECG. But the fee is the same. So the medical fees are underestimated and not reflecting the reality. Well, most of the pediatricians expected that we're going to face this kind of trouble in a gradual way within 10 years or something. But since 2020, everything just happened within a year. So we faced a shortage of residents in training, and that resulted in the pediatricians in the total population. So I think now this is the time we have to react very actively, proactively, I would say. And if we do nothing, the situation is going to get worse.
Right, and talking about acting then, Dr. Dan, what can you share with us about efforts over in the US perhaps to ensure an effective pediatric care system?
Right. So in the United States, during the Vietnam and the Korean conflicts, the Korean War, it was noted that timely access to medical care was a major determinant of outcomes for emergency conditions. And so Congress passed in 1973 an Emergency Medical Services Systems Act that really helped to bolster the EMS, or the emergency medical service in the United States. And there was a definite improvement in emergency medical care between 1975 and 1979 after the passage of this act. But it was noted that even though there was an improvement for adults, there wasn't really an improvement for children in terms of emergency care. So about 10 years later, in 1984, there was an Emergency Medical Services for Children's program that was enacted, and this authorized the use of federal funds to help with delivery of services in emergency care, and also for research in emergency care for the pediatric population. And this has really made a difference. Basically, what they did is they went through an evaluation of what sort of resources are needed in an emergency setting to provide high-quality emergency care, resources in terms of equipment and also personnel. And for health systems that were deficient in these resources, federal funds then could be applied to help bolster these health systems. And it has really made a difference. And this is an ongoing program. According to the U.S. Department of Health and Human Services, for the last funding cycle, almost $35 million were provided for funding for systems and states that are participating in this program. And it has really made a difference in terms of improving emergency medical care services for children throughout America. The goal is anywhere in America, all children and adolescents should receive high-quality emergency medical care. And this act has really worked to provide that.
Right. Well, the Korean government itself, Professor Kim, is also seeking to act to provide effective care to their children, of course. And as part of such efforts, the government has shared a new blueprint with regard to offering such care for children. What has been included in this particular blueprint, and what are your personal thoughts regarding it?
Yeah, I appreciate Dr. Dan mentioned about EMSC, and I hope that our government will make a research, look deep into those systems and apply to our country. I think this new government is giving up many plans for the pediatric medical service, and recently they make a plan to give some financial support to hire more specialists and equip more updated facilities and more moonlight clinics and 24-hour call service, something like that. Yes, definitely this is a good news, but it doesn't solve the fundamental problems hidden underground. I believe that there is enough candidates who is talented to become a pediatrician, and they are willing to become a pediatrician in the near future. But we have to build up a friendly environment in the decision they make to find some positive thinking about pediatrics. As I work in a tertiary university hospital, we should have a pleasant environment for education and for research, and enough manpower to take care of the critical patients and to deliver most updated medical care. And it will be the same for other specialties such as general surgery, OBGY, and even internal medicine, because they are starting to have a similar phenomenon right now. So yeah, we have to look at the whole picture.
Right, of course. Dr. Dan, another severe concern appears to be the tangible discrepancy, if I may, in regional statistics regarding avoidable mortality. That being said, could you start off first by telling us what avoidable mortality means, and how do you explain this particular discrepancy?
Right, so expected mortality is when a person lives a full life up until their expected lifespan. So that would be maybe close to 80 years for a Korean, and they're healthy throughout that lifespan. Then we have and expected mortality. We have premature mortality when a person dies before their expected lifespan, and preventable mortality or morbidity is the death that occurs because the right treatment was not delivered at the right time, basically. And in Korea, according to statistics from 2020, if we look at the 4 provinces with the fewest number of doctors per 1,000 population, they all had preventable mortality rates above the national average. So it's hard to make a one-on-one cause and effect correlation, but certainly the signals are showing that when you have too few physicians for your population, that can lead to adverse health outcomes. And so this is something definitely that needs to be addressed. Of course, having doctors who are willing and incentivized to work in, say, rural areas, in primary care settings is very important. And the OECD has recognized that South Korea does need to bolster its community health and primary health care. We're very hospital-centric in terms of how we deliver our medicine, and the OECD has recommended that we pay more attention to primary health care.
Right. And Professor Kim, what more can you tell us perhaps about the challenges of hiring and keeping doctors, especially young doctors, within rural settings here in the country?
I had a chance to work in a rural area in Gangwon-do and Gyeongsang-buk-do twice in my career. Well, in a free democratic country, more doctors will not end up with more doctors in a rural area. I think it's impossible, and I don't believe in the public medical school will work out. It'll rather end up in a more complicated situation without improving critical care service. As Koreans have a high standard of living right now, we do have a higher demand for medical service also. But as the national health insurance system was just held as a low price as possible, there was some gap between that demand and the service. The advantage of living in rural area as a doctor, yeah, there is an advantage, but they should have same burden with higher income or lesser burden with the same income. Either way, I think let the market decide this one. And in a critical care situation, we have to approach in a multidisciplinary team. I mean, one doctor is not enough. Sometimes we need pediatricians, we need surgeon, we need anesthesiologist, and many consultants backing up the whole service. So it's very hard to be equipped with everything. So if you look at the most favorite specialties for the medical students, it's far from taking care of a critically ill patient. So, I mean, they don't want the patient in the intensive care unit. So if you work in a rural hospital, this phenomenon gets worse. So, within 5 to 10 years, most of the senior doctors will be retired. And at some point, suddenly, we will have no more doctors to take care of those critical illness, especially in a rural area. So this is the time to do something.
Right, I see. And given the severity of the situation, Dr. Dan, I understand this might be a difficult question, but do you have any suggestions as to how to address this current problem that we're facing?
Right, so we need to acknowledge that it is completely unacceptable for a country that has such high standards of living to have high levels of preventable mortality and morbidity. So that's the first step. Just as the US enacted a law that allowed for federal government spending to bolster deficient areas in healthcare delivery, I think South Korean government can do the same thing. We need to examine the problem, not just microscopically, but also take a holistic picture of what's going on. Many doctors have talked about a total revision of the reimbursement rates for medical procedures. And we need to take into account not just the procedural fees, but also the operational costs. Just as Professor Kim was mentioning, there are a lot of hidden costs and economic factors that go into the practice of medicine, and that all needs to be taken into account. I think we can also talk about a system of hospitalists and nocturnists who work in the hospital. They just take care of inpatients, and perhaps expanding and supporting a system of doctors who take care of inpatients and critically ill patients is something that can be considered. We can also talk about incentivizing, as I said, doctors who work in primary care fields and also in rural communities. And we have to ask, well, what do doctors really want? Doctors want one, they want to be able to take care of their patients, deliver the best medical care possible. And then doctors want to be able to take care of their families. So perhaps we can offer incentives in just as we do for people who are in active military service or in foreign service, so diplomats who are in hardship countries. There are, I think, special quotas for university acceptance, a point system perhaps to help those families and to encourage the children of the hardworking doctors in the countryside to really work hard and have a chance at getting into a good university. That's something that can be considered. It's done for other people, right, who are in public service. I think that could be done for physicians as well. There can also be perhaps this tuition waiver or a stipend program for medical students who agree to go into community health or private health in a rural setting, say for 3 years after their training or after their medical school. So there are a lot of things that can be considered and put into place. Doing nothing is not an option.
Right, of course. We need to take action at this point, I suppose. And very briefly speaking then, Professor Kim, what words perhaps would you like to share with prospective physicians as we seek to better respond to this medical shortage?
Well, yesterday I was on duty and I had a call from 119 that a sudden teenager was collapsed, and bystander just called, and they told me that he's unconscious and maybe twitching, having a seizure. So I was on duty with 2 medical students, and they saw all the things happening. I was preparing for the worst, but thank God that it was not that serious. The patient was alert when he arrived to the emergency department, and finally it was just happened to be the vasovagal syncope, which was much less serious than I expected. And the students were studying about syncope, and they saw all the process in a live manner. Well, I hope that this will be some kind of inspiring for the medical students and encourage them to go to an area that is caring about the critical patients. And they're very cautious that they don't want to do some kind of thing that will harm their quality of life. But I say predicting the future is not the domain of humans. So I wish that the young students and doctors take a step forward and believe in a bright future.
Right, hopefully we'll keep our fingers crossed for that. And is the teenage patient okay now, recovering quite well?
I think he went home. Yeah.
I see, all right, that's good to know. All right, Professor Kim, as always, thank you very much for your time and your thoughts. And Dr. Dan, as always, thank you very much for your insights.
Thank you.
Right, well, on that note, we say goodbye. Thank you for watching, and do join us again same time tomorrow, that is Friday, for our panel session on the rights of same-sex couples.